everyone. Welcome and thank you for joining us for this special session of Fulfillment Series. This is a space where we engage in meaningful conversations that empower, educate, and inspire us all to live our God-ordained purpose. My name is Dr. Uvik. I'm a professor, a consultant, and the creator of Finding True Fulfillment. My co-host of this fulfillment series is my friend, Dr. Vari Dai. She's a lawyer and an author who is joining us from Canada. The month of March in general is dedicated to women. And so for today, we want to dive into an essential topic, which is women's health. We'll be focusing on the physical, medical, and gynecological perspective of health. Women's well-being is not just about an individual. It is about a thriving community. It's when one woman is healthy, it builds stronger families and healthier societies. In spite of all of this importance attached to women's health, we see that women continue to face challenges, especially in understanding our bodies and also advocating for our own well-being. But we do know that the Lord cares about our health, wants us to be healthy. John 1 verse 2 says that, "Beloved, I pray that you may prosper in all things and be in health, just as your soul prospers." That means that the Lord expects us to be healthy, spirit, body, and soul. So we have this amazing panelists with us today to dive into these topics. But before that, I'll let my co-host say a few words to set the stage.
Thank you very much, Eunice. And in this discussion, we will explore critical aspects of women's health, physical fitness and wellness, preventive and medical care. And so our esteemed panelists will share expert insights, address key concerns, and offer practical guidance on how women can take care and take charge of their health at every stage of their life. And so tonight, let's make this discussion very enlightening and empowering, because we have very esteemed professionals with us today, and I'm sure they all have something valuable to say to us. So I'll allow Eunice to start the introduction of the first two panelists.
Awesome. So our first panelist, and when I mention your name, just say hi. We have Mrs. Caroline Crow-Watson.
Hi.
So Caroline is an author and a fitness coach living in Hot Springs, Arkansas. In fact, she has two books, but her second book is titled Becoming a Holy Woman. If you can see it from my camera, I don't know if you see so well. I love this book. Hopefully we will get a chance to have a session with her to talk so much deeply about how to tie all of this together, soul, spirit, and body. So she's here with us today. Mrs. Savannah Spinks is a nurse with 11 years experience as a labor and delivery nurse. She has helped several women over the course of her career. She and her husband, Andrew, are youth pastors at TTAG. So I'm so happy to have her here to share her perspective on women's health when it comes to the gynecological aspect of our lives. So I'll let Vari introduce Dr. Deborah.
So it is my pleasure to introduce my sister, Dr. Deborah Dye Torrington, who is a medical doctor. She has been a medical doctor for more than 30 years, and she is a specialist in internal medicine, and she currently practices in Toronto, Canada. But apart from her expertise as a doctor, she's also actively involved in church. She is in the usher ministry, and she's also in the hospitality ministry, and she's a very valued member of our church. And so tonight, I'm really honored to have her join us to share her knowledge in medicine.
Awesome. So I'm going to open with a general question for all the panelists. From your perspective, what are some of the most common health challenges women face today, and what key steps can we take to maintain an overall well-being? Anyone can start. I think Caroline, you can go ahead, please.
Okay, thank you. In my line of work, I often come in contact with women who suffer from hypertension. Hypertension or high blood pressure is when the heart is pumping harder than normal. And over time, when this continues to happen, the arteries of the heart will start narrowing and hardening. and will eventually cause or increase the risk of developing heart disease and in a number of other different health conditions. That's why it is very important to pay close attention to the symptoms that you may be experiencing. I would like to call it listen to your body. Pay close attention to your body. Listen to your body. Paying attention, you have to pay attention to the shortness of the breath. Pay attention if you are having headaches pretty frequent. Pay attention to pay attention to the fatigue. And if by chance you so happen to experience some of these symptoms, that doesn't necessarily mean you are experiencing high blood pressure. But if you recognize that this is an ongoing problem, then I suggest you check it with your local healthcare provider. Another thing I want to mention is that it is said that women represent almost 52% of death from high blood pressure. That's a high percentage. That is more than 50%. So again, pay attention to your symptoms and see your physician when necessary. I just want to keep stressing that. So the next question is, how can a woman maintain her overall well-being? The number one key is eating a healthy diet with foods that are rich in whole grains, fruits, and vegetables. Make sure you stick with the low dairy product and those foods that are low in saturated fat. The key number two is water. We very seldom talk about the water, but our bodies are made up of 60 to 80% of water. Please hydrate, hydrate, hydrate. Key number three.
Awesome, awesome, awesome. So maybe I just let Savannah and Dr. Deb also say a few things on that question so that we can keep it moving. You will have the chance to add some more, Caroline. I know you are in your groove right there.
Thank you.
Okay,
Go ahead,
so
Savannah.
I think one of the things that really plagues women today is just depression and anxiety in general. Women just carry the weight and burdens of the family on their shoulders, and they're responsible for all the big details and all the little details, and that can seem very heavy. And I just think that oftentimes that we as women feel alone in that. Depression, anxiety, I think is something that women really deal with. And some of the things that I think that we can use to combat that is just getting outside, getting sunshine, exercise, getting the proper nutrition, like Miss Carolyn said a minute ago, and making sure that we are just building in quiet time for ourselves and really speaking about the things that are bothering us out loud, instead of just keeping it to ourselves and keeping it bottled in to where you do feel alone because you're not sharing those thoughts and feelings with other people.
That's awesome. Dr. Deb, please.
yeah, so I agree with Savannah. The commonest thing that women struggle with is emotional issues and body image issues. And like Savannah said, most of it's because of carrying the weight of the entire family. Also a lot of emotional burden, meeting the bills and taking on the banner for the entire family. The other issue that is body image issue, because there's a lot of obesity, and mostly the obesity issues is because women do not know. They need a lot of guidance with how to eat, exercising, and what is good for them. Most times they will tell you, well, I want to lose weight, but I don't know what to do. And like you said, going on social media, they can be guided in the wrong direction. So we are here to steer them into what the best way to achieve a healthy lifestyle is. As well, there's a lot of, coming back to Caroline, there are a lot of issues with mechanical issues because not doing the right exercises, not wearing the right footwear and all that. So there are a lot of pain. That together with the emotional issues culminate into pain issues. So most times women have a lot of pain in their feet, pain in their back, and they think it's a systemic issue, but it's not really a systemic issue. It's trauma in addition to poor body mechanics.
Thank you all. That was so deep.
Awesome.
Thank you. Awesome.
Thank you. Okay, so now I will move on to the second question. And I have a question first for the gynecology nurse. And my question to you is, what are the most common gynecological concerns you see among women, and how can they be managed?
I think that right now that we are seeing a lot of women and younger just show up and have breast cancer. They have ovarian cancers, frequent UTIs, things of that nature, yeast infections. One thing that we can do to combat some of that is what Miss Carolyn again said earlier, drink. We need to be drinking our water, flushing some of that bacteria out of our system. Also our recommended screenings that we should do yearly or for your age and whatever season of life you're in, depending on your risk factors and your the way you live. If you've recommended a screening for, say, I'm 35 years old right now, I'm not at the time where I would be recommended to get a yearly mammogram until I'm 40 years old. But when I turn 40 years old, I need to go get those yearly mammograms. Now I am at the age though to go get pap smears, and I believe that the recommendation now is every 3 years. You can correct me if I'm wrong, Dr. Deborah. And that is something that we need to keep up with. And it's something so simple that you can do if you have insurance. All insurances pay for their recommended health screenings that we should have. And that keeps you healthy. And I know no one likes to go do those things. I don't like to go do those things. But in the long run and in the future, it really does help combat. And it's not only preventative, but if you are going and doing those things regularly like you should, if you are susceptible to maybe having cancer, it's going to catch it earlier rather than later when you start having major symptoms.
Thank you, Savannah. And I hear a recurring theme there: drink lots of water. Well, we know how important water is, but it seems that, we tend to minimize the importance of water. And I'm glad that is coming out again today. And Caroline, you mentioned screening, and, that ties in with the question I have for Dr. Deborah. And my question to her is, what screenings and tests should women prioritize at different ages, whether you're at 20s, 30s, 40s, 50s, 60s, 70s, 80s, at different stages of life? What are the different screenings that should be prioritized?
Thanks for that question. Yes, coming back to what Savannah said, we talked about, you said that one of the common concerns with women is breast cancer. And we mentioned that this is aside from the screening, breast cancer, as it is known, is seen in the elderly. But more and more these days, younger patients, even if they are not at the age for screening, they are developing breast cancer. So to what Savannah said, I would suggest that women, young girls from as early as 25 should do their monthly or weekly breast examination, even if they do not qualify for mammogram. And I say this because just 2 weeks ago, and I can say this because I'm not calling names, but I met a patient who was 31 years old, right? She was already diagnosed with breast cancer, treated with lumpectomy, radiation, and chemotherapy. So even though we have the screening guidelines, we should still listen to our bodies, do our self-examination, and if something does not seem right, we need to see our healthcare provider. And this particular person said, I went to my doctor and they said I was too young, but I had to insist that this is not right. So I would encourage people to, yes, there are guidelines that we all work with, but we like to say patients do not write the textbook, right? So you have to know and listen to your body. And that said, I'm going to outline a list of guidelines. So if you're in your 20s, 30s, the pap smears, the UTIs, the pap smears. So cervical cancer screening should begin from if you're sexually active, should begin from about the age of 21. And these are the Canadian guidelines. But now there's the HPV, which is human papillomavirus testing. And because young girls are given this vaccine, it is pushed back from 25. So from age 25 to 29, you should start your your cervical cancer screening, and it's once every 3 years. As you get older, it's more frequent. When do you cut off the cervical cancer screening? If you've had 3 negatives, then it's okay to stop. Or if you're age 70, you do not need to do cervical cancer screening. And the other common thing is the breast cancer screening, like I said. So the guidelines say age 40 to 74 years old. But if you are not 40 years old and you see a lump, please see your practitioner and at least get an ultrasound or get a needle biopsy to ensure that it is not cancer. So the breast cancer screening is done every 1 to 2 years. Initially, so I think the US is different. The US started at 40, the Canadians started at 50, or if you have a family history of breast cancer, you should start at 10 years earlier. And the next screening that is important is the colon cancer screening. We know that colon cancer is very common these days, and it is important that young women from 40 years up, 50 if you do not have a history of colon cancer, and 40 years to have your regular colon cancer screening. You can either have the fecal occult blood test, so that is they send you a kit with a stool sample, and you need to put a stool sample and send it to your physician, or a sigmoidoscopy, or as you get older, colonoscopy. Some patients do not qualify for fecal occult blood or sigmoidoscopy. Those are the ones who've had a family history of cancer or who had risk factors for cancer. They have to get a colonoscopy. And what is a colonoscopy? Colonoscopy is the gastroenterologist gives you light sedation, and they go in from below and they look into the intestine to see if they're seeing any masses or any polyps or any abnormalities. Those are sampled and as a preventative manner. If patients are screened for colon cancer and is caught early, it is curative. Diabetes is the next big one, especially in certain population, Caribbean population. Diabetes is another big one. So you should start getting screened from age 35 to 40, right up to age 70. High blood pressure. In the Black population, high blood pressure is very common, and they get malignant high blood pressure, meaning that their high blood pressure is so high that it's difficult to control. So they should be screened, and from 18 years, they should get screened for that. So those are the commonest ones. And then by age group, 40s, you look at your cholesterol, your blood pressure, breast cancer screening. 50s, regular mammogram. Bone density is another big one. Bone density is checking how fragile your bone is. So as you get older, or if you have certain diseases, or if you're frail, your bones are fragile and they can break. So you, from age 50, you should have your bone density done regularly. In the 60s, regular screening, just like before. Vaccinations like the shingles vaccine, the pneumococcus vaccine, because older patients with diseases like diabetes and cancers, they are at risk for shingles and they're at risk for pneumococcus. And in the 70s, same, like focus on maintaining health, falls prevention.
Wow, Dr. Deborah, we need a full session for just you.
Can I ask
That's
two quick questions?
amazing.
Can I ask
Yes, go ahead, please.
two quick clarifications? Can you explain briefly what are shingles and what is pneumococcus?
So pneumococcus is a bacteria. It causes pneumonia. And if you're younger, your ability to fight pneumonia is stronger, but as you get older and you have certain diseases, you're like, in the layman terms, your resistance cannot fight off the disease and you can succumb to it. So you're vaccinated against that. Shingles is if you've had chicken pox, those virus doesn't go away. It lies under your skin. And then from time to time you can get pain and a rash in certain distribution. And that as well, if you're older and you have comorbidities like diabetes, cancers, high blood pressure, it can be your body would not be able to fight it off. So they vaccinate you against those.
Thank you. Thank you so much for that informative, very informative session. So I'll hand over to
Yes.
Eunice now. She will ask a few more
Yes.
questions.
So Thank you so much for all of what has come so far. I think our viewers are going to learn a lot from it. When I turned
Mhm.
50, I was told to do the colonoscopy. I was mad, but I did it anyway. I had to do it. So I think this is really good. Now, let's change our focus a little bit to physical health, physical and fitness, because this is something that most people ignore. So, to Caroline, how does regular physical activity benefit women beyond just weight management? And what are some of the simple but effective workout for all fitness levels?
When it comes to physical fitness, there are endless benefits that we can get from it. And going back and listening to Dr. and Savannah talking about seeing the number of women coming in with breast cancer, it would definitely lower the risk of breast cancer, colon cancer, arthritis, stroke, and all those different type of things. So, like I say, it's endless when it comes to physical fitness to be able to combat some of these diseases or lower the risk. Cognitive function, you may be experiencing, say for instance, like brain fog or concentration. Physical fitness also help combat that. So as again, it is endless. So I encourage every woman just as going and getting the yearly screenings to also adopt some type of exercise regimen.
Is there any simple, effective workouts that anybody at any age group can do? What do you
Yes.
recommend?
It can be as simple as going to a walk, going for a walk in the neighborhood, a brisk walk, swimming, or riding your bike. These type of exercises right here, right there, combats cardiovascular diseases. And then you got strength training. It's also important because it helps maintains the muscle mass and also it's versatile. So you can perform these type of exercises by body weight exercises. And in particular, one very simple, a plank. Just a simple plank will do more for your body than anyone can ever imagine. Resistant bands, they have become very popular here in the last decade. You have yoga. Some people may prefer to call it stretching, but either way, this is a low pack exercise that can improve the flexibility, your balance, and your core. And with that being said, this also would help combat and reduce stress and anxiety. I heard Savannah speak on that earlier. So yoga, gentle body stretching, these are gentle exercises that can be done at any age and can be modified to suit different abilities.
Thank you so much, Caroline. Honestly, I will speak for those who don't know how to do planks. And I may be number one. I have been modifying. I want to get to the stage where I can actually do maybe 2 minutes, maybe one day. But I love walking. Just a 30 minutes walk a day clears my mind. So thank you so much for mentioning that. Dr. Deborah, maybe can you tell us a little bit also about exercise? How does exercise impact women's health, reproductive health, including menstrual cycle, fertility, menopause? You all can chip in on that, but I'll let Dr. Deborah start on that one.
Okay, so exercise is very important for both your mental, physical, and psychological health, right? The simple walking, and there are guidelines for walking. I think it's 3 to 5 hours per week at least.
3 to 5 hours a week?
I'm sure that includes walking around your home, Eunice.
Yeah, no. Brisk walking,
Brisk.
not around your
Okay.
home. You're setting out to walk, brisk walking, 3 to 5 hours, at least three, sorry, I'm wrong. 3 to 5 hours, at least 3 days a week will help with both your mental, physical, psychological health. So if you're depressed, right, and you're alone, you go out there, you go for a walk, it helps with the blood supply to your brain. It helps to distract you. It helps with obesity, like the more you walk, calories in, calories out. So walking is one of the basic ones. It also helps to regulate your body hormones. So the people with menstrual cycle um issues, it can help with maintaining that. It can help with ovulation. So it helps with maintaining your cycle. Also helps with weight loss. Low impact exercises. So as you get older, your body, walking may not be enough. And so, Caroline can correct me if I'm wrong. It will not be enough. So you need a little bit of weights, not 20, 30, 40 pounds. We're not exercising to be for show. You're exercising to be healthy. So low impact with small weights will help to tone your muscles. And once you tone your muscles, then your bones will be stronger. For osteoporosis as well, it is felt that patients who are lighter are at more risk of osteoporosis. So you need more muscle mass, and walking improves that as well.
Wow. This
Yeah.
session has been so good. Man, wow. I have a lot to do. Valerie, which one are you picking? Anyway, I'm like, do you have a follow-up question on these? For the
Yeah, I think
exercise?
yeah, she wants to add something else.
Okay, go ahead. Sorry.
Okay, so when we're talking about exercise, I forgot. The area I work in, I see a lot of these. People will tell you, I walk a lot, I go on the treadmill and all of that. Footwear is the key because you can be walking, you can be exercising, but if you don't look at your posture and you don't wear the right footwear, you can hurt your and then when you're doing treadmill as well, it's not how high you can go on the treadmill, it's the distance.
Awesome. Thank you so much for that. So,
Yes.
Valerie, you want to talk about nutrition?
Yes, let's talk about nutrition. And again, this question is for the doctor and the fitness coach. Either one of you can start and chip in. How does diet influence women's hormonal balance, their energy levels, and their overall health? Any one of you can deal with that.
Well, again, as I first stated, that a well-balanced diet is very crucial to every woman overall health. You know, it's crucial for the hormonal support. We should eat healthy fats, you know, not the bad, but the healthy fats, foods that are rich in fiber. Adequate protein intake is also crucial for hormonal production. And I can't say it enough, regular exercise, weight management, sufficient sleep, stress management, all these things are key components in helping maintaining our hormonal balance as well as supporting our energy level and our overall well-being.
Thank
Yeah.
you, Dr. Deborah.
Yeah, I agree. A healthy diet. But I find that if I tell someone to use a healthy diet, they would like, well, doctor, what do I eat? I don't know what to eat, right? So the goal is when we were little in school, they would say more vegetables, less carbs, less rice, because most of us are from a culture where rice is our staple. So try to cut down on the amount of rice or the amount of bread we're using and use more vegetables. Healthy fats. And you do not only have to get your fats from meat, right? So you can use like avocados, you can use like whole milk. The people who are lactose intolerant, you can do like almond milk and soy milk. So less carbs, more proteins, more vegetables. And there's something called a DASH diet. So it means a diet high in fiber, high in protein, and low in carbs. In addition to the diet and exercise, there's also certain essential vitamins. Lots of people think that if they're eating well, they don't need vitamins, but a vitamin like vitamin D is very important to help with muscle strength and to help to build your bones with bone loss. And vitamin D, it is felt that if you're getting sunlight, you do not need vitamin D. Well, that's a myth. Yes, vitamin D comes from the sun. But in North America, how much sun do we get? Right? So we have winter in certain parts of the world for at least 6 months. And even if there we do not have, we're covered. So vitamin D comes from the sun, but it has to be absorbed in the skin. So if you're covered, you're not getting vitamin D. That's number one. Number two, even if there's sun, you're indoors most of the time. You're in a car, right? So you're not getting enough vitamin. In the Caribbean, the people tell me, "Oh, I'm from the Caribbean. I will go back home and get some sun." No, your body has vitamin D receptors. Once you're exposed to the sun for so much for a period of time, they close because they want to protect you from the sun rays. So you do not get enough vitamin D from the sun. So everybody need to be on at least 2,000 international units. That's Canadian standards, 25 micrograms American standard. Vitamin D for bone health. Vitamin D also helps with depression. It helps with cardiovascular health. Magnesium is another vitamin you can use to help with muscle strength, especially if you're exercising, because most people get pain after exercise, and it's because your body is producing certain acids that it's going to cause pain. So water, water, water again, and magnesium to help with muscle strength.
Okay.
Awesome.
I have a
think
follow-up
they've
question.
covered.
I have just
Okay.
one follow-up. Just to get the amounts right, you said the Canadian standard is 2000 IU and the US standard is 25 mcg.
Sorry,
How is
correction. It's 1000 IU is equal to 25, so 2000 is 50.
Okay, so the American standards, so it's the same then. American
Yeah.
and Canadian standards are the same
Yeah,
in
it's
terms
just the
of
units
vitamin
are
D.
different.
Okay, some people say I take 500 IU of vitamin D per day and they think that's enough, but I'm glad you said this because when you buy those drops, I think those drops have most of them have 1,000 IUs in them. So essentially we should have 2 of those drops each day in order to get enough vitamin D. And, I'm glad that this information is being put out there to correct a lot of myths that people have. Still on the topic of nutrition, this question is for our gynecology nurse and for the doctor as well. And the question is, are there any specific nutrients or supplements that women should focus on for their reproductive and long-term health? Maybe we can start with Savannah.
I think Dr. Deborah earlier was reading off a lot of my notes because I had the exact same thing she just said. The folic acid, though, is definitely important during our reproductive years. If we're having babies that we need to be, or even if we are not trying to have a baby, if we are at the age where we could be reproductive, that folic acid is definitely important to take because that can help develop a baby in the womb. That's good for fetal development. She mentioned a minute ago vitamin D. Vitamin D from the sun. Vitamin D is closely related or could be closely related to depression. One thing that we see, she mentioned 6 months out of the year, we're going through wintertime, and you've heard the term seasonal depression used. Seasonal depression's in the wintertime because the sun's not shining as much. Okay. So just having those times that we are outside in the sun, getting the extra vitamin D supplements like she mentioned, because we don't get enough from the sun. Calcium is good for us when women, as they age, they are more prone to osteoporosis. Calcium is good to help keep that bone strength. Vitamin B6 for our energy levels. We get run down easy because we live in a busy society. So keeping up with that vitamin B6 to help support our energy. And then iron, I would say women lose blood once a month. So just keeping up those iron levels, that also helps our energy to make sure that we're not anemic. We're definitely more prone to that as women because of that monthly menstrual cycle that we have.
Wow.
Thank you, Savannah. And I'll let Dr. Deborah chip in here.
Yeah, so in addition to, folic acid, yes, is very important. And if you're planning pregnancy, if before you even get pregnant, it's always important to use your folic acid. It helps with the baby's development, particularly the development of the brain. In addition to the vitamins, the calcium, magnesium, there's something called gestational diabetes. So you have to watch your diet, your carbs, your sugar intake, and all of that. Exercise, again, is very important because you need strong muscles. Even during pregnancy, there are exercises classes you can do, which will teach you the right techniques for pushing and all that, and develop your muscles. Yeah, so mostly vitamins. And coming back to the vitamin B6 and folic acid, what I advise, even outside of prenatal or perinatal, which is before pregnancy and during pregnancy, I tell them to get a B complex, so it has all the B. So you can do a B100 or a B50, so it has all the 6, the 9s, the folic acid and everything, and that is preparing. And vitamin B is, as you said, Savannah, vitamin B is like a stress pill. So you're active, you're busy, you have this busy, and it helps to prepare you mentally and physically for the day going forward. Yeah.
Okay, now, thank you. And before I hand over to Eunice, I have one question for both of you. What would you say to people who would often say, well, I eat the right foods, and so I don't need to take extra vitamins. What would your answer be to a statement like that?
So, that is controversial because some doctors feel that once you eat the right foods, you do not need to take vitamins. But we know that vitamin C is water soluble. So if you get oranges and you have to transport them from Mexico to Canada, right? When it gets here, you're not getting much vitamin C, right? You need to top up. Vitamins, also vitamin C, and it builds your immunity. So it helps you to fend off all these viral infections like the flu season and all that. Your vitamins are important. There's some of them you do not need as much, like as Savannah said, you need in the early ages, in your pre-menopause, like if you're young and you bleed and heavy bleeding, you need iron. But as you are if you stop menstruating and there's no bleeding, you don't really need as much iron. So that is the thing. But things like the vitamin C or it is seasonal. Vitamin D you definitely need, right? So there is a role for vitamins in society and thing, but it's on an individual basis. And the people who are saying I do not need vitamins, I would say not so much so. You're wrong, especially where you're living and how you because the first question pushback I get is like, so can't I get vitamin D from my food? But there's not a lot of foods that will give you vitamin D. They're not the amount you need. Vitamin C as well. I talk about the fruits. So the fiber, yes, you will get, but vitamins you need to top up.
Okay. Wow.
Awesome, awesome, awesome.
Thank you so
Thank you
much.
all
Over
for
to you, Eunice.
Thank you all for insights because this is very, very useful to all of us, especially
Yeah.
women. We hear a lot of things. People talk about a lot of things on Instagram, but you all are practitioners. You've lived it. You are giving us free advice, and we really appreciate you. So for the closing and takeaways, if you will each use maybe 1 minute or less, what is the one health tip that you wish every woman should follow? Let me start with Savannah.
I would say build in quiet time to your day. Whatever that looks like for you, build in some time that you can walk away from the stimulation of life. My favorite thing to do when I just need rest time, and rest time for me doesn't look like a nap, but to go in my room, lay on my bed, turn the lights off, close the blinds, even if there's a white noise in the background, and just take time to be quiet for a little while.
Wow, that's awesome. Can we hear from Caroline?
Yes, my health tip would be first, if you've ever flown on a plane, you have heard the flight attendant say to put on your own oxygen mask before helping anyone else. And to the women, I would like to say, in order for you to be a help to your family, to a good co-worker, you got to first take care of your own well-being.
That's awesome. Dr. Deborah?
Okay, I would say that remember health is not only physical health, it's psychological and mental health as well. So for you, if you want to be able to help others and you want to be healthy, start with your mental and psychological health. So take periodic breaks, pace yourself, eat healthy, and do your exercises.
Thank you all so much for all the insights. I really like your health tips. I hope I can just put those out there one by one so everybody can hear this. So thank you for all your time and insights today. And as we always say on this channel, fulfillment is not a destination. It's a moment by moment experience. The Lord cares about our health. And as you've heard today, we all have a responsibility in that, in ensuring that we are living healthy. That includes decisions about what we eat, what we drink, water, physical exercise, and all that contribute to getting a fulfilled life or living a fulfilled, healthy life. So stay tuned to our health segments that we will bringing up from time to time. We will be having a health nugget. Hopefully, we will get to have each one of you to go deeper into everything we talked today. We really do appreciate you all. Thank you so
Thank
much.
you.
Thank you so much. We appreciate you.
Thank you.